come to our model on the heart. This would be the first model under the topic of the heart. In this model, we'll focus largely on the gross anatomy of the heart. In a separate model, we'll talk about the histology and the embryology. The heart is the muscular organ of the cardiovascular system. It is found within the thoracic cavity, hence the reason why we're talking about it in this particular model. It is surrounded by the pericardium, just similar to what we see in the lungs being surrounded by the pleural membrane. So the pleural membrane is homologous to the pericardium when we contrast the heart and the lungs. In terms of dimensions, the heart is described as being a clenched fist shaped organ. It weighs about 300 to about 500 grams, and if this increases, we usually tend to refer to it as an anomaly. Usually we call that cardiomegaly. The heart is located specifically at the middle mediastinum between the lungs. It occupies a large chunk of that particular space, and it tends to, however, deviate towards the left part of the thorax. So the heart is not necessarily found centrally in the thorax, although it's found in the middle mediastinum, but a large chunk of the heart tends to be more towards the left of the thorax than towards the right. And as a result, we have the heart impinging on the left lung, thereby causing a bit of impression on the left lung. Usually, they tend to say the reason why the left lung has just two lobes, whereas the right lung has just three, is because of the heart's pressure on the left lung has caused the middle lobe of the left lung not to develop. So that's usually one of the theories that they tend to see. But the main point you need to take from that is that the left side of the thorax is occupied largely by the heart and the lungs. And as a result, the heart tends to have a bit of impression on the lungs. Let's talk about the relations to the heart. Talk about the relations and structures surrounding it anteriorly, posteriorly, inferiorly, and laterally. Anteriorly, we have the anterior mediastinum just in front of the heart, and that's separated from the heart by the pericardial membrane. Besides the anterior mediastinum, we have the sternum itself and the rib cage also found anterior to the heart. Posteriorly, we have the posterior mediastinum, the vertebrae, and the esophagus found posterior to the heart. Inferiorly, we have the central tendon of the diaphragm, which is the site where the heart sits on directly. And then laterally, we have the lungs by left and the right lungs flanking the heart on the sides. In terms of extent, the heart tends to extend vertically from the fifth thoracic vertebrae down to the ninth thoracic vertebrae. And then horizontally, the heart extends from the second intercostal space down to the fifth intercostal space on the left side of the thorax. So remember that it has more of its structure occupying the left side of the thorax, and it tends to span this, or it's not necessarily horizontal, it's more obliquely. It tends to run obliquely from the second intercostal down to the fifth intercostal space. There's a concept known as the role of force for the heart. This talks about the different features or the structures of the heart in terms of four major parts. So we talk about the four chambers of the heart. The heart has four chambers to it. We talk about the four surfaces of the heart, the four borders of the heart, and then the four valves of the heart. We talk about each of these different roles of force in the next couple of slides. Starting with the four chambers of the heart, this includes the right atrium, the left atrium, the right ventricle, and the left ventricle. Usually, the atriums tend to sit above, and then the ventricles tend to sit below. So the right atrium, as you can see here, is separated from the left atrium by what we call an interventricular, an interatrial septum rather. So we have the atrial septum separating them, not necessarily shown in the image here. Then the right ventricle is separated from the left ventricle by what we call the interventricular septum. So this is the interventricular septum shown here in pink. Then the atrium and the ventricles are also separated from one another. The right atrium is separated from the right ventricle through what we call the atrioventricular valve, We'll talk about some of the other valves very soon. And the left atrium and left ventricle are also separated by the atrioventricular valve on the left side. There are names for each of those valves, and when we get to the section under the valves, we'll mention each of them. What you need to note about those chambers and why the heart has various chambers is because of the flow of blood. So usually we say deoxygenated blood tends to flow on the right side, whereas oxygenated blood tends to flow on the left side. So we have the oxygenated blood coming from the superior vena cava and inferior vena cava and entering into the right atrium. That the oxygenated blood would be moved from the right atrium to the right ventricle, and then from the right ventricle it is pumped out of the heart through the pulmonary artery or pulmonary trunk, where it gets to the lungs and becomes oxygenated. After the blood has become oxygenated, that blood is taken back into the left side of the heart through the pulmonary veins. So we have oxygenated blood entering into the left atrium, and then from the left atrium, that blood is taken to the left ventricle. From the left ventricle, that oxygenated blood is pumped out of the heart through the aorta. Let's talk about the surfaces of the heart. We have four major surfaces to the heart. This includes the anterior or sternocostal surface, the inferior diaphragmatic surface, the right pulmonary surface, and the left pulmonary surface. As you can see, these surfaces are related to structures that are surrounded or surrounding them. Just to briefly talk about each of the surfaces, starting with the anterior or sternocostal surface. This is formed largely by the right ventricle, and it's the surface in direct contact with the ribs and costal cartilage, as well as the sternum. Then we have the inferior or diaphragmatic surface. This is the surface that is formed largely by the left ventricle and partly by the right ventricle. So it's formed mainly by the left ventricle, but some part of the right ventricle is also involved in forming the diaphragmatic surface. As the name implies, this is the surface that tends to be related to the central tendon of the diaphragm. Is the part that sits directly on the central tendon of the diaphragm. Then we have the right pulmonary surface. This is formed largely by the right atrium. It is in contact with the right lungs. Then the left pulmonary surface is formed largely by the left ventricle, and it's usually in direct contact with the left lung. We have four major borders to the heart. This includes the right border of the heart, as shown here. Then the left border of the heart. The left border of the heart is marked at this point. Then the inferior border of the heart. The inferior border is the area that is outlined here. And then finally, the superior border of the heart shown up here. So each of these borders have different shapes as well as are formed by different parts of the chambers of the heart. And in terms of extent, we also need to know them. So, for example, the right border is said to be convex in shape. So you could easily see the convexity of the right border in this image. You can see how it's convex, bulging out. That right border is formed by the right atrium, and it extends from the superior vena cava here down to the inferior vena cava here. So you can see that the entire right border is an extension of the superior vena cava to the inferior vena cava, and is formed largely by the right atrium. The inferior border, whereas, is nearly an horizontal border, although not shown here, it was nearly an horizontal border. It is formed mainly by the right ventricle. So the right ventricle forms it. So this chunk is the right ventricle, and then slightly by the left ventricle. So both the right and left ventricles forms this inferior border, and the inferior border spans that entire length spans the left ventricle, the portion of the left ventricle down to the portion of the right ventricle. Then on the left side, we have the left border. The left border is oblique or almost nearly vertical. You can see it's oblique or almost nearly vertical in terms of its orientation. It's formed largely by the left ventricle and slightly by what we call the left auricle. I'll talk about what the auricle is. But the left ventricle forms a large chunk of the left border alongside the left auricle. And then finally, we have the superior border. Superior border is formed by the right and left atrium and the auricles. So the right and left atrium and auricles tend to form the left border. There's the left border here. And this left border, what is unique as shown in the image, is that the ascending aorta and the pulmonary trunk tends to emerge from this border, and then the superior vena cava tends to enter the right side of the border. So just the right side of the border is flanked by the superior vena cava, and then the border itself tends to have the pulmonary trunk and the aorta. So this is the aorta here, and there's the pulmonary trunk emerging from it. So you can see that clearly in the image. So just to recap the borders of the heart, the right border, like I said, is formed by the right atrium. The left border is formed largely by the left ventricle and partly by the left auricle. The superior border is formed largely by the right and left atria and their auricles in anterior view. And then finally, the inferior border is formed mainly by the right ventricle and slightly by the left ventricle. Let's focus a little bit on one of the areas of the borders of the heart that I didn't mention in the previous slide, and that's the apex of the heart. So the apex is the most inferior and most anterior aspect of the heart. It is formed by the inferior part of the left ventricle, and in terms of location, it's said to be located at the left fifth intercostal space in adults. Usually, this is the area we tend to palpate when we want to feel for the apex beats. It's approximately about 99 centimeters from the midline, and there's some clinical relevance to the apex. Apex tends to underline the site where heartbeat may be auscultated from on the thorax. So when we are auscultating, especially for the closure of the mitral valve, which is one of the first heart sounds, we tend to do that at where the apex is. So we put our stethoscope on the left fifth intercostal space. And also, like I said, we could also palpate for the apex beat at that particular point as well. The apex beat is the part or the site where we have the maximum heartbeat that can be felt during the cardiac cycle. Now, the second aspect of the borders of the heart that I did mention in the previous slide is the base. The base of the heart is the most posterior and most superior aspect of the heart, just like how the apex is the most inferior and most anterior. The base is formed largely by the left atrium, with few contributions or less contribution made from the right atrium. So the left and the right atrium will contribute to form the entire base of the heart. The base lies anterior to the bodies of the sixth to ninth thoracic vertebrae. It receives pulmonary veins on the right side and the left side of its left portion, and it receives superior vena cava and inferior vena cava at the superior and inferior ends of the right atrium portion. Let's move on to the valves of the heart. We have four major valves of the heart. This includes the tricuspid and bicuspid valve, and then the aortic and pulmonary valves. We tend to classify or group these valves separately. So the tricuspid and bicuspid valves are known as the atrioventricular valves. They're the valves separating the atrium from the ventricle, and then the aortic and pulmonary valves are known as the semilunar valves. They're the valves that tend to separate the ventricles from the aorta and the pulmonary trunk. So each of those valves tend to play different roles as described by the classification. And it's also important to note that the valves tend to be the cause of the heart sound. So whenever there's a closure of a valve, that leads to the creation of the heart sound. The bicuspid valve is also known as the mitral valve. So and each of them tend to serve separate roles in terms of where they are found. So just to quickly talk about all the valves in a nutshell, the tricuspid valve is found in the right part of the heart. It separates the right atrium from the right ventricle, and it is made up of three cups, hence the name tricuspid. The bicuspid valve or the mitral valve separates the left atrium from the left ventricle. It's found on the left side of the heart and is composed of two cups, hence the reason why we call it bicuspid. The aortic valve, whereas, is found at the junction between the left ventricle and the aorta, so it tends to separate both of those structures. It's composed of three cups, and each of the cups tend to look like half of the moon, and that's the reason why we tend to name those valves as semilunar valves in shape. And then finally, the pulmonary valve is the valve that separates the right ventricle from the pulmonary trunk. It's composed of three cups as well, and is also semilunar in shape, as similar to the aortic valve. Let's dive deep into the actual structures of the heart. We'll talk about the external structures of the heart and the internal structures of the heart, and we'll focus on each of the chambers. We start with the right atrium, then we go to the left atrium, the right ventricle, and then the left ventricle. We'll talk about both external and internal structures for all of these particular chambers. Starting with the right atrium, there are five major external structures that tend to form the right atrium. This includes the right auricle, the coronary sulcus, the semilunar terminal, the sulcus terminalis rather, the superior vena cava, and then the inferior vena cava. So what are each of the structures and how do we identify them? Starting with the right auricle. The right auricle is an ear-shaped conical muscular pouch that projects from the chamber or the right atrium, like an added on room, it tends to increase the capacity of the atrium as it overlaps the ascending aorta. So if you look at the picture here, this particular um, appendage that you can see extending from the side of the right atrium is the right auricle, and its presence there is just an to serve as an extra space for the right atrium, so an extra space for blood to be filled by whenever we have blood returning from the superior vena cava and from the inferior vena cava. That's the function of the right auricle. Um, if we go beneath the right auricle, we'll notice the coronary sulcus. Coronary sulcus is the line in this particular, is the depression at the that I'm outlining in this particular image. Coronary sulcus is the depression that separates the atrium, that's the right atrium in this case, from the ventricle. So if you look at it, anything above the coronary sulcus is the atrium, anything below the coronary sulcus is the ventricle. So it separates the right atrium from the right ventricle as shown in the image. Then we have the sulcus terminalis. Sulcus terminalis is a shallow vertical groove that tends to be found externally, separating the smooth part of the rough the smooth part from the rough part of the atrial wall. Now it's not necessarily shown here, but I'll show you the homologous or counterpart to the sulcus terminalis when we look at the internal structures. But just know that the entire right atrium is divided into a smooth and a rough part. And externally, what divides that right atrium from smooth and rough is what we call the sulcus terminalis. Just imagine that there's a line that divides the atrium into a smooth part and a rough part. On the outside, that line is called sulcus terminalis. And finally, we have the superior vena cava and the inferior vena cava. These are groups of large veins that tend to send or drain um, polyoxygenated or deoxygenated blood into the right atrium. So you can see the superior vena cava up here. It's receiving venous blood from different aspects of the upper limb, head and neck, and the upper chest. Then we can see the inferior vena cava located down below. It drains venous blood from the lower limbs, the abdomen, pelvis, and the perineum. Let's talk about the internal structures of the right atrium. So if we cut open the right atrium and we look into it, we will then see a number of structures. There are about 7 of this. This includes the sinus venarum, the pectinate muscle, the crista terminalis, the intraatrial septum, the fossa ovale, opening of the coronary sinus, and the right atrioventricular orifice. So each of these structures have particular functions that we need to know about, starting with the sinus venarum. So the sinus venarum is the smooth part of the right atrium. So it's a smooth, thin walled posterior aspect of the right atrium. Remember I said in the previous slide that the right atrium internally has a smooth and a rough part. The smooth part is found at the back, the rough part is found in front, and the smooth part is known as the sinus venarum when we cut it open to visualize it. It tends to be the site where the superior vena cava, the IVC, and the coronary sinus empties into, and they all empty and drain the oxygenated blood into that portion of the heart. So if you look also, so this area marked in this by my highlighter here is the area that marks the sinus venarum. You can see how smooth it is. If you look directly at lateral to that part, as shown in the image here, you see that there's a rough portion there. The rough portion here is the pectinate muscle. The pectinate muscle is the rough muscular part of the right atrium. It's found anteriorly on the right atrium, and it is separated from the sinus venarum, is separated from that smooth part by this line. So they can see the line that separates them. This line is known as the crista terminalis. So crista terminalis is the line that separates the sinus venarum, the smooth part of the right atrium, from the pectinate muscle, the rough part of the right atrium, and it is found internally. The crista terminalis is the counterpart to the sulcus terminalis that we talked about in the external structure. The external structure, which is the sulcus terminalis, separates the rough part from the smooth part externally when we're looking from the outer part of the right atrium. When we're looking at the interior of the right atrium, the line we see from the interior is the crista terminalis. Other structures you need to also pay attention to will be the right atrioventricular orifice. This separates the right atrium from the left atrium. This separates the right atrium from the the right atrium from the right ventricle. It is the site that tends to be surrounded by the tricuspid valve. So the orifice is the area shown here. You can see this valve at this point. This is the atrioventricular valve, the tricuspid valve. So this orifice, like I said, is the opening that separates the entire right atrium from the right ventricle, as shown here. And that's the right atrioventricular orifice, and its function is to allow for flow of blood from the right atrium down to the right ventricle. Then we have the interatrial septum. Interatrial septum is the aspect of the right atrium that separates it from the right ventricle. So from the left atrium. So the right atrium is separated from the left atrium by virtue of the interatrial septum. And on the intraatrial septum, there's a very tiny depression. That depression is an oval shaped depression known as fossa ovale. So fossa ovale is shown here in the image. It's found on the intraocular septum. The fossa ovale present there is represents the remnants of a very important embryological structure of the right atrium known as the foramen ovale. So when we talk about the embryology, we'll talk about how the foramen ovale eventually becomes the fossa ovale and what was the function of the foramen ovale during embryology. Then finally, we have the opening of the coronary sinus. The coronary sinus is a short network of veins that tend to eventually drain into the right atrium, carrying the oxygenated blood that supplies or that supply the heart back into the right atrium. So the opening of the coronary sinus, however, not shown in this image. Oh, yeah, okay, it is shown in the image. Is this portion here? You can see how it drains into um the the smooth part of the right atrium, carrying that deoxygenated blood that is coming from the cardiac veins. Let's talk quickly about the left atrium. On the external part of the left atrium, we have three major structures to note. This includes the left auricle, the coronary sulcus, and the pulmonary veins. These are the structures located on the external part of the left atrium. The left auricle, just like the right auricle, is an ear-shaped conical muscular pouch that tends to project and gives an extra chamber or added room, increasing the capacity of the left atrium. The coronary sulcus, also similar to what we see on the right atrium, is a depression that tends to separate the left atrium from the left ventricle. You can see the coronary sulcus being this depression here, separating the left atrium above from the left ventricle below. Then we have the pulmonary veins. You can see a set of four sets of veins that tend to drain into the posterior part of the left atrium. They tend to drain oxygenated or richly oxygenated blood coming from the lungs back into the left side of the heart. These are the four pairs of pulmonary veins. You can see them. This is one, this is two, and this is three and four. So each of these drains oxygenated blood back into the left side of the heart. When we cut open the left atrium and we look into the interior, we tend to see a number of structures, six of them. The left atrium, just like the right, has a smooth wall part and a rough part made up of muscles. And it also has its own set of left atrioventricular orifice and intraatrial septum. And it has what we call the floor of the fossa ovalis and the valve of the fossa ovalis. So the smooth wall and the pectinate muscle aspect of the left atrium is not as well distinguished or differentiated as that of the right atrium. So if you pay attention, you notice that there is a rough part in this image. This is the rough aspect or the pectinate muscle part of the left atrium. And you notice that the majority of the entire left atrium tends to be smooth. So the left atrium has that smooth part being the posterior portion and being the large aspect, and the smooth portion of the left atrium is where the pulmonary veins tend to drain into. And then the rough part is just a tiny, and it's the tiny part that is positioned in the anterior aspect of the left atrium. Then the left atrioventricular valve, also similar to the right side, is a small orifice or opening that is guarded or blocked by the mitral valve that tends to separate the left atrium from the left ventricle. It allows for flow of oxygenated blood from the left atrium into the left ventricle. Then we have the interatrial septum. Interatrial septum, just like the one we saw on the right side of the heart, separates the left atrium from the right atrium. Then finally, we have the floor and valves of the fossa ovalis. The floor and valves of the fossa ovalis are for the floor, it's a semilunar depression of the intra-atrial septum that tends to be a remnant of the foramen ovale. So it's just similar to the fossa ovalis we see on the right side, but in this case, it's just a part of the fossa ovale that we see on the left side. So the floor is just the semilunar depression, whereas the valve is the ridge that tends to be at the edge of the floor, tend to border the floor of the fossa ovale. Each of these structures are all remnants of the foramen ovale, as we'll discuss during the section under embryology of the heart. Let's talk quickly about the right ventricle and the left ventricle. Starting off with the right ventricle, let's talk about the external structures we see in the right ventricle. These are structures that include the coronary sulcus, the interventricular sulcus, and the pulmonary trunk. So let's start off with the coronary sulcus. Coronary sulcus is just the same coronary sulcus we talked about when talking about the right atrium. It separates the right atrium from the right ventricle, as shown here. So this is the coronary sulcus. And then we have the interventricular sulcus. Interventricular sulcus is the depression found at the anterior part of the heart, separating the right ventricle from the left ventricle. So this is the interventricular sulcus. It separates the right ventricle from the left ventricle. Then finally, we have the pulmonary trunk. The pulmonary trunk is an extension of a of vascular structure that continues as an outflow tract of the right ventricle. So if the right ventricle is going to pump blood out of the heart, it's going to be pumping blood through that pulmonary trunk. So you can see the pulmonary trunk being an extension of the right ventricle as a vascular structure, and it's involved in carrying poorly oxygenated blood out of the right ventricle into the lungs. And one other thing to note about these structures, particularly the interventricular sulcus, is the fact that it tends to carry important vessels on it. If you pay attention, you notice that there's a very important vessel. The important vessels found there. There is the great cardiac vein found on the interventricular sulcus. We also have the anterior descending um, interventricular artery, also found on that interventricular sulcus. When we cut open the right ventricle, we see a number of structures that tend to form it. These structures include the right atrioventricular orifice from above, the tricuspid valve, the chorda tendineae, papillary muscles, trabecular canal, conus arteriosus, supraventricular crest, the pulmonary valves, the interventricular septum, and the septomarginal trabeculae. This is a mouthful, but let's talk about each of them one by one, starting with the right atrioventricular orifice. I said before, it's just a similar orifice that tends to separate the right atrium from the right ventricle. It allows for the flow of blood from the right atrium into the ventricle. Usually, the oxygenated blood is what flows through the orifice. That orifice tends to be surrounded by the valve, particularly the tricuspid valve. I mentioned the tricuspid valve when talking about the valves previously. Tricuspid valve tends to guard the entire right atrioventricular orifice, and is the image shown here. Remember that the tricuspid valve has three major cups: an anterior cup, septal cup, and a posterior cup that tends to guard the entire orifice. And then we have the chorda tendineae. Chorda tendineae are strings of fibrous tissue that tends to connect the tricuspid curve to the papillary muscle. So if you notice, the tricuspid valves are not by themselves. They are connected to the structures on the wall of the ventricle. If you notice, the structures on the wall of the ventricles are rough. They are rough muscular structures. One of them tends to be projecting upward, known as this is known as the papillary muscle. These are papillary muscles, yeah. And the papillary muscle that projects up is connected to the tricuspid valve through a string of fibrous tissue known as the chorda tendineae. So these are the chorda tendineae here, connecting the tricuspid valve to the papillary muscle. Papillary muscles are conical muscular projections, and like I said, they connect to they are connected to the tricuspid valve through the chorda tendineae. They are projections coming from the ventral wall of the coming from the wall of the ventricles. Then we have the um, then we have the the walls themselves, starting with the structure we know as the trabecular canal and the conus arteriosus. So just like we had the right atrium having a smooth part and a rough part, The right ventricle also has a smooth part and a rough part. Usually, the rough part of the right ventricle is known as the trabeculae carni. So it's the rough muscular portion on it. It forms the anterior inferior part of the right ventricle. So you can see that area where we have a lot of rough edges there, where the papillary muscles tend to project from, is known as the trabeculae carni. And then the conus arteriosus is the smooth part of the right ventricle, and usually the part that is found above is found superiorly and posteriorly, and it leads all the way up to the pulmonary trunk. If you look at this small portion at the upper part of the right ventricle, this is the conus arteriosus, and you can see how it projects all the way up towards the pulmonary trunk. Just before we enter into the pulmonary trunk, there are valves that tend to sit and separate the conus arteriosus from the pulmonary trunk. These valves are known as the pulmonary valves. There are three cuffs forming the pulmonary valves. They separate the pulmonary trunk from the right ventricle, and they tend to guard the exit of blood from the right ventricle into the pulmonary trunk. Remember that deoxygenated blood tends to leave the right ventricle, entering into the pulmonary trunk. Then we have some other structures not necessarily shown in this image. So some of them are shown, like the septomarginal trabecule is seen, and the supraventricular crest is also present. So each of these structures have different functions. The function of the septomarginal trabecule, it is a curved muscular bundle that tends to transverse from the right ventricular chamber from from the inferior part of the to the inferior part of the to the so it traverses from the right ventricular chamber from the inferior part of the interventricular septum to the base of the anterior papillary muscle. So it moves. So if you look at it, it moves from the interventricular septum here to a papillary muscle here, and its major function, it is to carry part of the neurovascular or neural structures of the heart, known as the atrioventricular bundle of His. So it carries the right branch of the atrioventricular bundle of His from the interventricular septum towards the anterior papillary, and that's the function of the septomarginal band. The interventricular septum, we just talk about it, is just a simple wall separating the right ventricle from the left ventricle, and that's the function of the interventricular septum. It's similar or akin to the interatrial septum that separates the right atrium from the left atrium. So let's finish up with the left ventricle. Let's talk about the external structures of the left ventricle. The left ventricle, just like the right, would have its coronary sulcus. It has interventricular sulcus as well, and it has the aorta and the apex of the heart being found there. The coronary sulcus separates the left atrium ventricle from the left atrium, so it's the depression separating the left atrium on this side from the entire left ventricle lower below. Then we have the interventricular sulcus. This is found posteriorly, contrast to the interventricular sulcus on the right ventricle. So the interventricular sulcus on the left ventricle meant to separate it from the right ventricle posteriorly, and it tends to lodge vessels, particularly the posterior descending interventricular artery. Uh, Aside these two structures that are very similar in the right and left atrium, one unique structure that we don't see on the right side is the aorta. The aorta is the continuation of the left ventricle on the left side. It is similar to the way in which the pulmonary trunk is the continuation of the right ventricle on the right side. So you can see the aorta being emerging from the left ventricle, running all the way up, and then eventually curving to form that arc. And finally, the apex beat or the apex of the heart tends to be formed by the left ventricle, and that is depicted in image here. When we dissect the left ventricle and we look into it, we see a number of structures very similar to what we see on the right side. This includes structures like the left atrioventricular orifice, the mitral or bicuspid valve, the chordae tendineae and papillary muscles, trabecular carni, aortic vestibule, supraventricular crest, and the aortic valve and interventricular septum. So these are all structures that are very similar in function and in property or in feature to those that are found in the right ventricle. So the left atrioventricular orifice separates the left atrium from the left ventricle and allows for flow of blood from the left atrium to the left ventricle. Remember that oxygenated blood flows from the left atrium into the left ventricle. That left atrioventricular orifice is guarded by valve, and the valve that guards it is known as the mitral or bicuspid valve. You can see the bicuspid valve present here. And just like the tricuspid valve on the right side, the bicuspid valve is also tightly held together by the condylarthria tendinae that attaches to the papillary muscles in the left ventricle. So we also have condylarthria tendinae, strings of fibrous tissue connecting the mitral valve or the bicuspid valve all the way down to this muscular projection on the wall of the left ventricle known as chordae tendineae. So we have papillary muscles, we have chordae tendineae, and we have the mitral valve, similar to what we see on the right side. Besides that, the left ventricle, just like the right, also has a smooth and a rough part to it. The smooth part of the rough part of the left ventricle is known as the trabeculae carneae. The smooth part of the left ventricle is known as the aortic vestibule. So similar to what we see in the right ventricle, where we have smooth and rough parts. For the smooth parts, that trabeculae carneae forms the inferior and anterior part of the left ventricle, whereas the smooth part forms the posterior and superior part of the left ventricle. The aortic vestibule, which is the small part, it leads all the way up to the aorta. It is usually separated from the aorta by the aortic valve. So the aortic valve separates. It's not necessarily shown well in this image, but if you notice, this is the small part of the left ventricle here. This is the aortic vestibule, and you notice that it is separated from the aorta by this set of valves here. This is the aortic valve, the semilunar valve on the left side of the heart. Then finally, we have the interventricular septum that separates the left ventricle from the right ventricle. Then we also have the supraventricular crest. Supraventricular crest is a thick muscular ridge that separates the smooth part from the rough part. So I didn't mention that in a previous slide, but what tends to separate the smooth aortic vestibule on the left side from the rough trabeculae carneae on the right side is a ridge known as the supraventricular crest. So just imagine a line separating the smooth from the rough part. We also have a supraventricular crest on the right ventricle, separating the smooth part of the right ventricle from the rough part of the right ventricle. Let's talk about arterial supply to the heart. The arterial supply of the heart comes from two major arteries. This includes the right coronary and the left coronary arteries. This arteries emerges from the beginning point, origin point of the aorta. So as the aorta emerges from the left side of the heart, it first of all gives rise to the right and left coronary artery. Each of these arteries tends to supply different aspects of the heart, and we'll talk about that in the next couple of slides. Starting from the right coronary artery, it arises from the right aortic sinus, just directly above the aortic valve. So it's superior to the aortic valve and emerges from the origin point of the aorta. After it emerges, it tends to first of all move between the pulmonary trunk and the right auricle, and then from there it runs along the coronary sulcus on the right side. So that coronary sulcus that separates the right atrium from the right ventricle is going to lodge the right coronary artery as it descends towards as it moves towards the back of the heart. So it runs from the aorta through the coronary sulcus to the back of the heart, where to supply structures present. So usually the coronary artery tends to terminate at the back of the heart. It anastomoses with another set of artery known as the circumflex branch of the left coronary artery. Both of these arteries together will give rise to what we call the posterior interventricular artery, or we call the descending interventricular artery. And that artery is involved in supplying a number of structures. It tends to supply the adjacent part of both ventricles. It sends what they call a septal branch to the posterior one third of the interventricular septum. So it supplies the posterior one third of the interventricular septum. These are some of the branches of the entire right coronary artery, aside the terminal branch. So the terminal branch is the posterior interventricular artery, but aside the terminal branch, it also has a right marginal branch that supplies the right atrium. It also has the SA nodal branch and the AV nodal branch that supplies the SA node and the AV node respectively. Let's talk about the left coronary artery. Left coronary artery arises from the left aortic sinus behind the pulmonary trunk, just directly above the aortic valve. After it emerges, unlike the right coronary artery, the left coronary artery splits almost immediately. So as it emerges, it divides, or first of all, courses through the pulmonary trunk and left auricle, and then immediately divides into two major branches. These branches includes the anterior interventricular branch and the circumflex branch. So the circumflex branch tends to run along the coronary sulcus, just similar to what happens on the right side. Remember that the right coronary artery by itself does not split, but runs on the coronary sulcus on the right side. For the circumflex branch of the left coronary artery, that's the artery that tends to run on the coronary sulcus on the left side towards the posterior part of the heart. And once it gets to the posterior part of the heart, it will do either of two things. Either it would anastomose with the posterior coronary artery to form the posterior interventricular artery, or it might by itself form the posterior interventricular artery. I'll talk about what this means. So sometimes in some individuals we see circumflex the circumflex artery forming the posterior interventricular artery alone. Sometimes we see it joining the right coronary artery to form the posterior interventricular artery together. So that these are variations in terms of the formation of the posterior interventricular artery that we'll talk about. And remember that I said the posterior interventricular artery would form or give branches that will supply a large chunk of the ventricles alongside the posterior one third of the interventricular septum. Aside the circumflex branch of the left coronary artery, the second branch is the anterior interventricular branch. So the anterior interventricular branch tends to just descend down the anterior interventricular groove of the apex of the heart. Remember that groove that separates the right ventricle from the left ventricle anteriorly. I said that groove tends to lodge the descending interventricular artery or the anterior interventricular artery. So this artery is found on the groove. The anterior interventricular artery supplies both of the ventricles, and it sends what we call a septal branch that supplies the anterior to third of the interventricular septum. So just like the posterior interventricular artery supplies the posterior one third of the interventricular septum, the anterior interventricular artery supplies the anterior two third of the interventricular septum, and that's very important to remember. What are the branches of some of these left coronary artery aside the ones we mentioned? We also have the left marginal branch that supplies the left atrium, and we have the esternodal branch that supplies the SA node. This is an image that depicts the entire discussion of the arterial supply to the heart. You will notice that on the from the aorta we have the right and left coronary arteries emerging. You can see how the right coronary artery emerges and then runs through the coronary sulcus as shown here, giving off a number of branches. You can see one of the branches it gives the acute marginal artery that would supply part of the right ventricle alongside the right atrium. And then you would also notice how the right coronary artery would run all the way to the back and end either by uniting with the circumflex artery, but that's not shown in this image, either by uniting with circumflex artery or by forming the posterior descending artery or posterior interventricular artery. So you can say this is the posterior interventricular artery. Remember I said this artery supplies the ventricles alongside the posterior one third of the interventricular septum. On the left side, you see the left coronary artery also emerging from the aorta, and you can see how it directly splits into two arteries almost immediately. It splits into the anterior descending coronary artery, or what we call the left anterior descending artery, or left anterior, or what we call the left interventricular artery, or anterior interventricular artery. This artery, I said, supplies the anterior to third of the interventricular septum alongside the ventricles. And you also notice the left circumflex artery that tends to emerge and wraps around the heart. That left circumflex artery, just like the right coronary artery, runs through the coronary sulcus of the left side and towards the back of the heart. Once it gets to the back of the heart, it can either unite with the right coronary artery or by itself form the posterior descending artery, which supplies the posterior one third of the heart. So let's quickly talk about a concept known as dominance. Dominance describes the ability of one or two arteries to give rise to the posterior interventricular artery or posterior descending artery. So depending on what particular artery forms the posterior descending artery, you could either have a left dominance, a right dominance, or a codominance. So if a person is said to be left dominant practically means that the left coronary artery, by virtue of the left circumflex artery, forms by itself alone forms the posterior descending artery. So you can see the left coronary artery, the blue part, forms the posterior descending artery by itself, and we see that in 8% of individuals. If we have a right dominant means that the right coronary artery by itself form the right coronary artery by itself would form the posterior descending artery. So that's shown in the image here. You can see how the right coronary artery runs all the way to the back and would give rise exclusively to the posterior descending artery in the image here. So in that case, we tend to see that in about 85% of individuals. And then finally, we have codominance. Codominance is when we have both the left and right coronary arteries. That's the right coronary artery and the left circumflex branch of the left coronary artery, together forming the posterior circumflex, or posterior interventricular or posterior descending artery, as shown here. So this is the posterior descending artery coming from two sources, from the right side and from the left side. And we see codominance in about 77% of individuals. Let's talk about the venous drainage of the heart. So there are a number of veins that are involved in draining blood from the heart. That's venous blood in terms of the blood supply to the heart itself. Just as the coronary artery supplies oxygenated blood to the heart, we all have some veins known as cardiac veins that drain blood from the heart. So these veins include the anterior cardiac vein, the smallest cardiac vein, the coronary sulcus, the great cardiac vein, the posterior vein of the left ventricle, medial cardiac vein, and the small cardiac vein. So I want to know that the first three veins, the anterior, smallest, and the coronary cardiac veins, or the coronary sinus rather, are involved in draining blood directly into the right atrium or directly into the heart. Then the remaining four veins, the great cardiac vein, the posterior vein of the left ventricle, the middle cardiac vein, and smallest cardiac vein, all drain into the coronary sinus. So the coronary sinus is the major drainage point of the veins of the heart. It is akin to the right and left coronary artery. So in terms of the proportion of venous blood that is drained into the heart from the heart itself, the coronary sinus takes a large chunk. It receives tributaries from four major veins. The great cardiac vein, this usually starts from the apex, ascends into the anterior interventricular septum of the sulcus, and meets the oblique vein of the left atrium to form the coronary sinus. Usually, it's the vein that directly gives rise to the coronary sinus, and it drains a large chunk of the entire ventricles of the heart. And we have the posterior vein of the left ventricle, that is found on the diaphragmatic surface of the heart and drains also into the coronary sinus. We have the middle cardiac vein. The middle cardiac vein then starts ascend in the posterior interventricular sulcus and then eventually enters into the coronary sulcus. And then finally, we have the small cardiac vein. The small cardiac vein is on the right side of the coronary sulcus and drains into it as part of its tributaries. Then we have the termination point of the coronary sinus. Coronary sinus tend to enter into the right atrium directly and drains all the blood it receives from the great cardiac, posterior vein of the left ventricle, middle cardiac, and then this small cardiac vein. The remaining two veins are the anterior cardiac vein and the smallest cardiac vein. The anterior cardiac vein drains directly into the right atrium, or it could drain into the small cardiac vein. So most times it tends to drain directly into the right atrium. So usually we tend to separate it when talking about the venous drainage of the heart because it is distinct from the coronary sinus. Then we have the smallest cardiac vein. The smallest cardiac vein is also called the vena cordis minimi. It is a miniature vein that tends to begin in the capillary bed of the myocardium and opens directly into the chambers of the heart. So it drains into the right and left atrium of the heart, particularly into the right side because that's where we have a lot of deoxygenated blood present. Let's go at the lymphatics of the heart. The heart tends to have lymph draining from it. The lymph vessels involved in draining the heart is known as the subepicardial lymphatic plexus, and then the nodes tend to receive the lymph drained by these particular vessels is known as the inferior tracheobronchial lymph nodes. In terms of nerve supply, the heart receives nerve supply from the cardiac plexus, which is a combination of sympathetic and parasympathetic nerves. Sympathetic part of the cardiac plexus is made from or arises from the cardiopulmonary splanchnic nerve, and then the parasympathetic part of the cardiac plexus is gotten from the vagus nerve. So let's end this model by talking about the clinical significance to the heart. The first would be cardiomegaly. Cardiomegaly is when there's an abnormal rise or increase in the size or weight of the heart. Usually the heart tends to measure about 300 to about 500 grams. If that exceeds 500 grams, then we refer to that as cardiomegaly. And then second would be the heart sounds and auscultation of the heart. So usually the heart sounds are produced by the closure of the valves. Whenever we have four valves, we have two atrioventricular valves, the tricuspid and bicuspid valve, and we have two semilunar valves, the aortic and pulmonary valves. When the atrioventricular valves closes, it gives rise to what we call the first heart sound. And then when the semilunar valves close, that gives rise to the second heart sound. Usually, the sounds could be auscultated at different points. We could listen to the closure of each of the valves at particular points on the chest wall. So usually we tend to listen to the closure of the mitral valve at the apex, the point where the apex of the heart is, or where the apex beat is. That's at the left fifth intercostal space, mid axillary line. Sometimes it could extend to the anterior axillary line. we would auscultate for the tricuspid valve. At this point, the tricuspid valve tends to be auscultated at the left fifth intercostal space at the parasternal line, very close to the sternum. So just at the border of the sternum is where we tend to auscultate um for the tricuspid valve. For the aortic valve and the pulmonary valve, we auscultate for them higher up. For the pulmonary valve, we tend to auscultate for it at the second intercostal space on the left side at the parasternal line, very close to the sternum. Or for the aortic valve, we tend to auscultate for it at the right intercostal space, second intercostal space, also on the parasternal line. So this is where we auscultate for the aortic valve. This is where we auscultate for the pulmonary valve. This is where we auscultate for the tricuspid valve. This is where we auscultate for the mitral valve. And then there's an extra way in which we tend to auscultate um, known as the EPS point, usually in between the pulmonary valve and the tricuspid valve. That concludes our module on the heart.